So the food you're feeding today can significantly adversely affect your pet's health in 2 to 3 years' time. Because dogs and cats are different, cats need those higher proteins. They're going to have a different microbiome system than dogs will. And that's because you need different bacteria. You need different things in that GI tract to break down the proteins, to break down the carbs, to break down the fats. They're digested very differently. Now, the digestibility of the food is what determines the extent of how well those nutrients are broken down and absorbed by the pet. And this is something that's missed when we're feeding kibble diets, processed diets. What is that digestibility of that food? So how well is it being broken down by the body and being utilized? Because what happens is when we feed a low digestible food, so typically our processed foods, kibble diets, dry food diets, they're going to be less digestible. They're not broken down before they reach the good bacteria or the bad bacteria. And what happens is that's affecting the microbiome. So now rather than all the proteins and things being broken down, and then there's some fiber and stuff to work on the microbiome, now that microbiome is like, oh my gosh, what is happening? And it completely changes the levels. So we'll see a switch between these different strains. The lactobacillus might go down, some of the other ones go up. And then we see over the long term, we see chronic disease, we see inflammation, we see infection, we see things like cancer, we see things like allergies. Diet's not going to cause an issue short term, usually. What happens is that we think that we're feeding like the right food, and we're like, they've been on this food for 2 years. They've been fine. And what happens? Bam! They get allergies, and you're like, they've been on the same food. Why is that causing a problem? That's why. That food has been creating a leaky gut, has been creating a dysbiosis this amount of time and changing those bacterial levels. That's why that happens. So the food you're feeding today can significantly adversely affect your pet's health in 2 to 3 years' time. Food is the long-term treatment plan. It is the foundation that we need to be looking at on how this is going to affect and ultimately, hopefully, improve and optimize your pet's health. So some of the interesting things, let's talk some specifics. There's actually a study. So let's talk about raw food diets, right? I never recommend transitioning straight from like kibble to raw, because that pet's microbiome is used to being on a kibble diet. So that microbiome has adjusted to that high carb diet. So we need to gradually change it. And there's supplements and different things that we do to transition to that. We're going to talk about that in our monthly webinar. Make sure you register. Go to thenaturalpetdoctor.com and you'll see a big pop-up and just register. And you'll learn about that. You're going to have a checklist. How do I transition? What do I need to do to get this pet over to this? What are those top supplements? How do you know the microbiome's off? We're going to cover that in our monthly webinar. But let's talk about raw diets, raw meaty bone diets, because it's such a taboo topic in pet health. What they found in studies when they compared dogs and cats that were fed a raw meaty bone diet compared to dogs that were fed a kibble diet is they actually had a more diverse microbiome than dogs and cats fed kibble diets. I'm not surprised, because that is more a biologically appropriate, highly digestible diet for dogs and cats. They have shorter digestive tracts, they have lower stomach pH, they can break down things much better than us. So there's not a long transit time for them to be exposed to things like salmonella, E. coli, all of those problems that we get worried about. And so, yes, they can. You need to handle the meat appropriately. All those things, we can get those. So you need to be careful if you are doing that. But if we can transition our pets to these diets, we're actually going to help feed their microbiome a lot better. With pets with inflammatory bowel disease, chronic, what we call enteropathies, inflammation in the GI tract, we've actually found in studies that they have decreased microbial diversity. So they don't have as many good bacterial strains. And what's really important is there's a decrease in the amount of strains that actually produce small chain fatty acids in the gut. And what we find is there's higher amounts of E. coli. And a lot of these pets are on kibble diets, not super digestible. So remember, a lot of that is passing through to the lower gut and affecting that microbiome. And so with inflammatory bowel disease, we truly, like, this is the most severe leaky gut, most severe leaky gut form. We need to be focusing on how do we reduce inflammation? What are the best foods? A lot of times what we'll do is we'll actually do a food trial, limited proteins, and lots of probiotics, digestive enzymes to help heal that GI tract lining. And then if that's not working, a lot of people will move to hydrolyzed protein diets. But a lot of these pets can do well with a home cooked diet that's already more easily digestible, but some will do really well with a hydrolyzed diet. So it just depends on your pet, and it can sometimes be a trial and error. However, the goal is to always prevent this from happening. And that's by looking at the foods we're feeding now and what's going on in your pet's microbiome and checking that and testing that.